This video will examine the standard needle blood flow probe for MCAO applications, or the MNP100NX310. This probe connects to our oxyflow system, and you can see the red ring on the probe connector matches the color of the oxyflow. It is robust and easy to handle because it is a relatively large needle, approximately a 20 gauge, and the end is blunt, so it doesn't cause punctures in the tissue when used gently. The needle is only 1 centimeter long. It's ideal for measuring changing perfusion of cerebral tissue where the contact site is usually very small and needs to be precisely placed. You can position it on the tissue surface using an external clamp, or the most common method for securing it in place, which is the dedicated miniature holders. You can see these holders in the Accessories tab on our website, and later in the video we'll show you how they can be used. These probes have unlimited reusability, providing that you take good care of them and keep them clean. They can be cleaned with 70% alcohol, and the white coiled cable you see in the photo on the right is approximately 3 meters long. The needle portion is 10 millimeters long, or 1 centimeter, and the diameter is 20 gauge, or 1 millimeter. The collar length is 16 millimeters with a 5 millimeter diameter. The needle tip is blunt, so it won't cause any tissue damage if used gently to place the tip of the needle to the tissue surface. And the sampling area of this probe is approximately 1 millimeter cubed, but that is dependent on tissue pigmentation. So now let's take a look at the dedicated miniature holders, which come in two sizes, a 5 millimeter wide and a 10 millimeter wide, depending on the size of your animal. The probe is inserted into the collar of the holder for secure attachment to tissue surfaces. This allows the user to leave the holder glued in place for repeat measures from the exact same region over time without having to leave the animal tethered to the oxyflow system. The holder can be fixed to the skull using dental cement or other approved adhesives, and the skin can be closed around the collar for chronic studies. Thank you for watching. And if you have any questions about the information that appeared in this video, please contact our application specialists or head to our website at www.scintica.com.